Yeah. Hello, everyone, and welcome. I am Jenny Levine, Associate Director for Ollie at Duke, and I am so pleased you're able to join us today. I'm going to introduce our speaker, and you'll hear all about this incredible program that we've had the honor of hosting here. And while I can say nice things about Vivo all day, you can also hear very good things from Ollie members who have taken the online course. One member shared the following. My experience with Vivo with Ollie was fantastic. The course was everything it claimed to be, and I felt stronger and healthier after it concluded. The instructors made everything possible, regardless of ability level, and yet it is challenging for those who want that experience. I loved it so much that I signed up for Vivo and have participated in 2 classes a week for a year. Now it's my pleasure to enjoy your Vivo team representative. Katie Starr is an associate professor of medicine at Duke University School of Medicine and research health scientist at Durham VA Medical Center. Sorry, I had to admit someone. 1 second. Dr. Starr is also co-director of the Duke Center for Aging Clinical Nutrition Laboratory, and her research and professional experience focuses on understudied older adult populations at high risk for chronic health conditions and functional disability. She's also the chief scientific advisor for Vivo. Thanks for being here, Katie. Take it away.
Yes, thank you so much. It is an honor. I love to be able to speak to our Ollie members. So what we're going to do today is I'm going to go through some of the evidence and research around what happens as we age from a physiological standpoint, what happens to our muscle health, our functionality, and then what are some of the interventions that we can do. And then I will actually dive into the Vivo programming and talk through what that actually looks like and how that can meet some of our needs to be able to mitigate that loss of muscle mass and strength that we naturally experience with aging. So I love to make this a two-way conversation. So yes, please feel free to put questions in the chat, and then we'll have time at the end also to answer any questions that you might have. So one of the way I always like to start these conversations is around really kind of talking about the fact that we know as we get older, the activities of daily living, the things that we love to do, they start to become a little bit more challenging, like walking up the stairs. Maybe prior to, maybe we're noticing, oh man, I actually feel much more sturdy if I'm holding onto the handrail as I come up the stairs. Or you know what? I'm going to do all the things downstairs right now, and then at the end of the day, I'll handle the stuff upstairs, just so I'm not having to go up and down the stairs just because it's difficult. One of the things that I really, really like to emphasize to individuals is that yes, we know that these activities are becoming more difficult. However, if we stop doing them, we are going to lose our abilities to actually continue to do those activities of daily living. So the adage use it or lose it is extremely important as we think about the role of muscle health and the impact that aging has naturally on our loss of lean muscle mass and functionality with aging. So always want to focus on use it and understand that if we don't, we are going to start to lose it. And really what I mean by that is around what actually happens to muscle mass as we get older. So what we know from our research is that at around 30 to 40 years of age, we really maximize, we're at the max peak of our muscle mass. And from there, naturally, we start to see a decline of our muscle health. We see a decline of up to about 8% loss per decade after the age of 40. That is going to then accelerate to around 15% loss per decade after the age of, up to 8% after the age of 40, and then up to 15% loss per decade after the age of 70. Now, where this up to and this potential differences is surrounded by chronic health conditions. When we have more chronic health conditions, we're going to see a higher level of loss. When we have less chronic health conditions, that progressive loss is going to be slowed down. Now, it's not just about the loss of muscle mass that we're actually concerned about. We're also concerned about the actual quality of the muscle. So what I have over here are two images. I have an image of a 20-year-old cross-sectional area of the thigh and a 70-year-old. What we notice on the 20-year-old muscle is we have what we call subcutaneous fat that's around the muscle. We need that fat. That fat is very healthy and very good. What we also see is a little bit of what we call marbling within this muscle, but not very much. This muscle is extremely a very healthy muscle. The muscle is able to contract and release like it is supposed to be able to generate that force and power that we want in a muscle. When we move to the muscle of an older individual, what we start to see is increased subcutaneous fat. So we know we start to see more fat around the muscle, but more importantly, we really see fat infiltrating that muscle. So we call this intermuscular adipose tissue. Why is IMAT or intermuscular adipose tissue important? It's important because of the fact that it starts to impact our ability to contract and release that muscle like it's supposed to. And when we have that fat infiltrating the muscle, our ability to actually generate force and power is going to be reduced. And so this is where we can also see an increased risk for falls because our ability to catch ourselves is impacted by that intermuscular adipose tissue. So this is our progressive loss of muscle mass that occurs with aging. What we also start to see with aging is a progressive loss of strength. So what we have here is I have on the y-axis muscle strength and on the x-axis age. And similarly with muscle mass, we see a peak of our muscle strength at about the age of 30 to 40. And from there, if we look at this dark blue line, what we start to see is this natural decline of muscle strength. Now, I have this salmon colored bar here that is the threshold of low physical performance. Once we start to inch into this threshold of low physical performance, this is when the things that we really need to do to be able to be independent start to become extremely challenging. So noticing our ability to get up and out of a chair, we're having to really push down to be able to get ourselves up or pull up on our tables to be able to get ourselves up. Being able to actually put on our shoes becomes difficult. Being able to transfer out of our bed becomes more challenging. Still able to do it, but it requires a lot more effort. Once we pass this threshold of low physical performance and move into that threshold of disability, this is where we have actually lost our independence. So this is where we're no longer able to get up and down off of the commode by ourselves, get in and out of a bath by ourselves, being able to dress by ourselves. So this is kind of a natural progression that occurs as we start to lose muscle mass in addition to that loss of muscle strength. Now, what I have here is this light blue line, and there is a clear separation. When we start to actually intervene and we do specific things like utilize exercise and nutrition, what we know is we can actually push that curve up so that we can extend our ability to continue with our strength and not and slow that movement up into that threshold of low physical performance and threshold of disability. What we know from a natural aging perspective is we lose around 10 to 15% per decade of strength after the age of 50. So again, when we think about this and put this together, this is that loss of muscle mass, loss of muscle strength that leads to loss of functionality. The term is known as sarcopenia. So it is the natural loss of muscle mass and strength that leads to a decline in our ability to move around. What I want to emphasize here is that there are two types of sarcopenia. We have primary sarcopenia, which is caused by aging, naturally occurs. And then we have secondary sarcopenia, where we see this in chronic health conditions. And some of those health conditions can be in individuals with cancer, individuals with chronic kidney disease, individuals with heart failure. These conditions have shown to really accelerate the aging process and also seeing that increase in muscle mass and muscle strength. So when you couple those two together with aging and the chronic health conditions, again, as I was saying previously, we're going to see an acceleration. Now, this is kind of doom and gloom. I just like to make sure we understand the science and the physiology that naturally occurs as we get older. Because again, I think wisdom is power. And when we have that wisdom, we're really able to understand, okay, this is the problem. What are our solutions? So the good news is there is absolutely something that we can do about sarcopenia. There's absolutely something we can do to slow down that process of loss of lean muscle mass and strength. And there's absolutely something we can do to maintain our function. We can use it instead of losing it. And I think that's really, really powerful. What the research has shown us is that it is absolutely scientifically proven that no matter what your age or your fitness level is, strength training can be reversed. Or strength training can reverse that age-related loss of muscle mass. It can help us build our bones, and it also can help restore strength and functional abilities. Again, kind of thinking about that curve, it can help us maintain and stay into that light blue line, pushing that strength up so that we do not move into that threshold of disability, ultimately leading to that loss of independence. So there is really two things that we really focus on when we talk about combating sarcopenia from a lifestyle intervention component. Those two things are exercise and nutrition. So specifically when I'm talking about exercise, we know that the CDC recommends 150 minutes of moderate physical activity or 75 minutes of vigorous physical activity to meet our recommended exercise requirements for cardiovascular health. So being able to really maintain that cardiovascular health that we need. When I say moderate physical activity, what I mean is we are moving to a place where we can still carry on a conversation, but we're breathing. We're it's a little bit difficult. When I use the term vigorous, it means that we are no longer able to really carry on that conversation. That's how we can really decipher or differentiate between what type of exercise we're in. Are we in that moderate or are we in that vigorous physical activity? One of the other CDC recommendations is being able to do resistance training at least 2 times a week. And what we're focused on is large muscle groups, all of our large muscle groups doing 8 to 10 repetitions, 8 to 12 repetitions, with those last repetitions being really more challenging to be able to actually complete. It is truly that resistance training that is the key to being able to combat sarcopenia. What resistance training does is it breaks down the muscle to build it up stronger. It really stimulates what we call protein synthesis. So that is where we're actually building up that stronger muscle. So we need our cardiovascular exercise. Absolutely. We need that aerobic exercise. But when we are really thinking about muscle health, it is strength training and resistance training that is really the key to being able to combat that sarcopenia and loss of lean muscle mass. Now, the next component, that next prong, is nutrition. High protein diets that include all of our essential amino acids and branched chain amino acids, are what really are going to be able to contribute to muscle protein synthesis, being able to really stimulate that muscle protein synthesis. Leucine is a metabolite that drives our muscle protein synthesis, and leucine is found in all animal-based proteins and also in some of our plant-based proteins. So it doesn't have to be all animal-based to be able to stimulate muscle protein synthesis. We can use complete proteins, so being able to build our protein sources together to be able to ensure that we have all of the essential amino acids, branched chain amino acids, to really drive that muscle protein synthesis. So I'm going to talk about nutrition first, and then we'll move back into exercise, just because I really want to be able to make sure that we fully understand the value of protein and how protein really does contribute to building our muscle mass. For most of us and most Americans, we consume protein similar to this diagram. So what I have here on the y-axis is our grams of protein consumption, and what I have on the x-axis is breakfast, lunch, and dinner. What we know is that most Americans consume a little bit of protein for breakfast. They consume a little bit more for lunch, and then most of us get our majority of our protein at our evening meal. So if we consume protein in this manner, we're still consuming around 90 grams of protein. However, what we know and what the literature shows us is that at around 30 grams of protein, that is where we actually start to see our ability to build our muscle. We actually start to see that ability to stimulate muscle protein synthesis. So when we eat in this skewed fashion of lower amounts for breakfast, lower amounts for lunch, high amounts for dinner, what we see is that we are only hitting that threshold of muscle protein synthesis one time per day. So this is not really maximizing our ability to hit that threshold and really being able to stimulate and send all of those essential amino acids, particularly leucine, into our bloodstream to be able to help us really actually build that muscle protein synthesis. However, if we still consume the same amount of protein, but rather spread that out throughout the day, what we can see is this repeated stimulus of hitting that 30-gram threshold, which can potentially show an increase or maintenance of muscle mass. So this is one way in which we can actually start to really kind of think about taking one day into day one. This is a change that we can actually start to make. And what I always tell people is, if you are eating, like most Americans, a little bit of protein for breakfast, a little bit more for lunch, and most of our protein at dinner, why don't we pick one meal? Lunch is usually our easier meal to really try to hit that protein requirement. And then we can start working on breakfast so that we can get in this more repeated maximum stimulus rather than doing a skewed approach of protein intake. The other question I always get is, what does this actually look like? What does muscle protein synthesis, or what does 30 grams of protein actually look like? Well, this is a wonderful example of ways in which we can actually get 30 grams of protein. And again, it's not a large amount of protein, but you do have to be mindful. You have to be mindful about what you're buying and what you're purchasing, and really being able to pay attention to the nutrition facts label. So one way we can do this is through our dairy protein, particularly Greek yogurt. Greek yogurt has higher amounts of protein in it compared to our regular yogurt. So a cup of Greek yogurt actually contains upwards to 30 grams of protein. And obviously we can top that with sliced almonds and raspberries to really create and round out that meal. And this is a great way to get in high quality protein. Potentially you could have that for breakfast. Another way we can get that is through adding our grilled chicken. So around 3.5 to 4 ounces of grilled chicken will give us 30 grams of protein. That's not a large amount of chicken. 3 ounces is about a deck of cards. 4 ounces is going to be just a little bit more than that. Similarly, we could add some lean pork tenderloin. Another way we could do this is with a breakfast burrito, getting a tortilla, eggs, egg whites, black beans, adding that with some shredded cheese. That's going to get us up to that 30-gram threshold. And then obviously I have some other examples of shrimp fajitas or chicken teriyaki. So these are just examples of ways in which we can start to really maximize that high quality protein into our diet. So again, it's not an Atkins diet. It's really just thinking about, how do I spread that protein out throughout the day to be able to hit that 30-gram threshold. Okay, so I'm going to move away from that nutrition component, and we're going to talk about strength training. So when I'm working with my patients, when I'm working with my clients, one of the big things that I'm often asking them is, when you think about strength training, what do you imagine? What is it that you're thinking of? And one of the things that I oftentimes hear is pain, having to lift heavy weights, having to strain, having to be in a gym setting. Really impactful on my joints. So what I want us to do is, I want us to take that image, and I really want us to throw that image out, because that is not what I'm talking about when I am talking about strength training and what we have actually shown to be beneficial for our development of and maintenance of muscle health and muscle strength. This is a wonderful example of strength training. So these are functional movement patterns that we can be utilizing in our day-to-day life. So for example, a squat or a chair rise, so rising up from our chair, that is mimicking our ability not only to get up from a chair, but also thinking about our activities of daily living, being able to get up off of the commode, being able to sit back down. I have an individual here doing a plank, a body weight plank, and I know some of you may say, I cannot do that. Absolutely fine. One of the things, though, that this movement pattern, along with that push up off of the chair, mimics is our ability to get up and down off of the ground. These were all strength training and resistance training movements, and they're movements that mimic things that we have to do in our day to day, like bending down and picking something up and reaching up. That is another wonderful exercise movement that we can utilize and do. And we can use our own body weight, or we can add resistance bands or dumbbells to be able to add a little bit um, more weight to it to really be able to maximize our and continue the progression of developing stronger muscles. So again, just wanted to demonstrate and show that strength training does not have to happen in a gym setting. It doesn't have to be painful. It doesn't have to cause swollen joints. It is not the idea of no pain, no gain. Rather, how can we utilize our daily activities, our movement patterns that we do to really be able to gain more strength and improve that muscle health? So one of my favorite parts of this talk is really being able to talk about the science behind the benefits of strength training and what we know from a scientific standpoint from our research studies that have been done. So all of these here are benefits of strength training. The first one, talking about enhanced strength and function. Obviously, it makes sense that when we start to do a strength training program, we see improvements in strength and in function. So the study that I have cited here is a study that looked at individuals who had not done strength training prior, started a strength training program twice a week. And what they found after 12 weeks was around a 25% improvement in upper body strength and lower body strength. The other improvements were their abilities to actually get up from a chair, walk around a cone, and sit back down. So we call that the 8-foot up and go. Their ability to do functional activity measures also improved. The number of chair stands that they were able to do improved. So not only building that strength, but also the functionality, our abilities to do the things that we love, those activities of daily living. Another area where strength training has been extremely beneficial is around sleep. So evidence has shown that when we start to implement a strength training program into our life, we not only see better sleep duration, so that ability to sleep longer, but also the quality of sleep improves. So actually being able to move into our sleep pattern of light sleep, deep sleep, REM sleep, and back through that pattern. Extremely important, right? Strength or sleep is where we actually restore our body. It's a restoration. So without sleep or disrupted sleep, we know that the body does not restore like it is supposed to. So by adding in that strength training, and these results were also seen within 12 weeks, the evidence showed improvements in both that sleep duration and that quality. Another area of importance is around incontinence. So a lot of times we know that individuals wake up in the middle of the night because they have to go to the bathroom. What the study actually showed too was that because of improvements in the pelvic floor muscles, individuals were not waking up because of having to go to the bathroom. So again, multiple improvements, again, not just from a sleep duration and quality standpoint, but also not having to that need to get up and have to actually go to the bathroom because of our pelvic floor actually being improved and strengthened. Increased longevity. So one of the other wonderful areas of research is not only doing randomized control trials where we look at individuals who do a strength training program versus those who don't, but the ability to actually follow people over a long period of time and look at their habits and see how does that impact their health outcomes. So a study that looked at the role of participating in strength training versus not and health outcomes showed that long-term individuals who did strength training not only had a reduction in morbidity, so chronic health conditions, also had a reduction in had improvements in longevity. Not only lived longer, but quality years were improved. This study really illustrates and showed that strength training as an independent variable. So even when controlling for age, even when controlling for other, for diet, chronic health conditions, showed that strength training was an independent factor in longevity. It's really strong evidence that points to the benefit of that strength training and role of strength training. Recovery from surgery. This is a really new area of research. It's an area that I work in, specifically looking at the role of strength training on post-operative outcomes. So we know that around a third of all older adults undergo an elective surgical procedure. We also know that older adults are at higher risk for post-operative sequelae. So longer length of stay, readmittance, impact of wound healing, so poorer wound healing, and also finally, reduction in ability to get back up to baseline functional status or slower ability to get back up to baseline functional status. So many surgical programs have actually started to implement what we call prehab, which is strength training before you actually undergo surgery. What the evidence shows is that by participating in strength training around 4 to 6 weeks before surgery, actual evidence to show that reduction in length of stay, improvements in wound healing, and improvements in the ability to get back up to your baseline functional status faster. So really exciting evidence. And so I always recommend anybody who's going in or planning for an elective surgical procedure to talk to your surgeon, talk to your healthcare providers about programs that could potentially allow you to prep for that, prepare for that surgery, and how you could potentially implement strength training before those surgical procedures. The last two areas that I want to talk about are around falls and caregiver burden. So first, reduction in risk of falls. It's not surprising that strength training helps us reduce that risk of falls. Like I talked about at the very beginning, we have intermuscular fat that infiltrates the muscle that happens with aging. And so that muscle doesn't function like it's supposed to. When we start to add strength training into our regimen, what we do is we see a reduction in that fat infiltration, making that muscle actually be able to respond better, respond properly. And that ultimately helps us reduce that risk of falls. Additionally, what we show is that when we start to do strength training, we start to see a reduction in fear of falling. Fear of falling is linked to falls. When an individual has a fear of falling, what we know is they start to shrink their life space. So what that means is they're not doing the activities that they used to do. They're starting to really minimize the activities that they're doing in their life. So that whole adage, like I said before, use it or lose it, really becomes into play where we start to see fear of falling leads to falls. Studies have shown that when you are doing a strength training program, individuals who do strength training programs see a reduction in that fear of falling, ultimately opening up that life space and utilizing that muscle so that they can do the things that they love. The last component that I want to talk about on this slide is around the reduction in caregiver burden and stress. We know that caregiving is extremely challenging. Also, we know that caregivers have poor health. They have patient-reported outcomes that are, really reporting that the way that they view their health status is low or poor. What we know is that by implementing strength training and exercise into individuals who are caregivers, it allows them to take time for themselves to improve their well-being. And so not only do we see all of these other benefits of participating in strength training, but also that reduction of caregiver burden and stress. And really, when we start looking at that qualitative data that comes out of these studies, it really centers around the ability to take time for themselves and really be able to focus on themselves for a small period of time, giving them that respite that they need to really be able to show up and be present for their loved one and the individuals that they're providing care for. So really strong evidence across the board, not only physical evidence, but also our mental health, our sleep, all of these components that are really powerful. The last area that I want to hit on is an area where we're seeing more and more research come out around the benefits of strength training on cognitive health. And what's really exciting about this evidence is we are seeing that we're seeing improvements not only in individuals who have signs of cognitive impairment or dementia, but also in individuals who are not showing any signs, which is very powerful. So we're thinking about it from a primary prevention standpoint, so slowing down the actual development of dementia, and a secondary prevention, which is having a health condition and slowing down the progression of that disease state. Very, very exciting. So studies have shown that by implementing strength training into your regimen, we see not only improvements in attention, but also in reasoning and in memory. And this was a study that looked at the role of adding strength training into twice a week. I believe this one was a 6-month study that looked at the role of strength training. And this was in individuals with cognitive impairment and without cognitive impairment, and showed these improvements in both attention, reasoning, and in memory. So very exciting, again, from a primary prevention standpoint and a secondary prevention standpoint. One of the other studies that I really love to talk about is around a study that looked at the impact of strength training on preservation of brain function and ability to complete cognitive tasks, showing that individuals in the strength training arm showed not only preservation of that brain function, but also abilities to complete tasks that require multiple components. So being able to complete complex cognitive tasks. So it's really that challenge of our brain and being able to actually follow through. And so being able to complete those at a faster rate. And the last study that I want to talk about is around preservation of brain structure and size. So what we know about our conditions of our brain health is dementia is associated with a decline in both gray and white matter. So really being able to maintain that gray and white matter is extremely essential. So this study looked at the role of strength training on preservation of brain size and structure and showed that strength training improved and preserved both gray and white matter. So again, showing that ability to preserve our brain health, brain functionality, and ultimately reducing the development of those cognitive impairments. Finally, another study just came out a couple of weeks ago. This is called the Pointer Study. And what it showed is that individuals who were in their 60s and 70s who started lifestyle interventions of both diet and exercise showed reductions in or improvements in cognitive health. It's a study that really emphasized the role of lifestyle and behavioral change, and that by participating in that can really slow down that progression of the development of cognitive impairment. So really powerful study. Happy to send that out to anybody who's interested, but you can look up the Pointer Study. It just came out a couple weeks ago. NPR has a really great article on some of the findings, and obviously the scientific articles are out there as well. Okay, so we have all of these beautiful benefits, but unfortunately, most of us do not actually do enough exercise. So we know that 30% of individuals who are 60 to 65 and older do not exercise at all. Only 20% actually meet the CDC exercise guidelines of aerobic physical activity, strength exercises, and that balance, and only 10% actually consistently participate in strength training. So really, really impactful. We have all of these wonderful, wonderful outcomes that have these studies that continuously show these very, very important benefits. However, from a standpoint of what are we actually doing to meet the recommendations, many of us are really not making this a top priority. So what are some of the objections that we see? What are some of those barriers to actually doing strength training? These are some of the barriers that we have found in not only the research I've conducted, but other research that has looked at what is actually preventing somebody from meeting these physical activities, particularly around strength training. And the barriers that we oftentimes see are I have aches, pains, and arthritis. So just kind of a myth buster here. We know that strength training is one of the best things that we can actually do for our joint health. So what we know is that strength training and cardiovascular exercises as well, when we are moving the joints, we're actually moving in synovial fluid around that joint. We're providing nutrients to that joint and getting the old synovial fluid out. Why is that important? Well, that's lubricating that joint that actually makes the joint feel better. So again, going back to that adage of use it or lose it, we know that individuals who do not move those joints actually are going to be in more pain compared to those individuals who do. And time again, we're showing individuals with OA who are actually exercising show and report lower pain than those individuals who do not. I don't want to bulk up. Yes, absolutely. So that's one of the concerns that we hear. I can't lift weights, not a problem. What we want to do is we want to start with your own body weight. Let's start with your own body weight, and then we can progressively move up as you get stronger. That is the goal. We want to continuously challenge the muscle so that we can continue to make that muscle build and, again, improve the health of that muscle. I already walk. Absolutely. Our cardiovascular fitness is extremely important. That aerobic exercise is really important, but that's only one part of the conversation. That second part is around that resistance training. So we want to be able to build our heart health with our cardiovascular exercise, but we also need to be able to build our muscle health with our resistance exercise. I will get hurt. 100% that concern about being hurt is absolutely a valid concern. And so what we always tell anybody who is starting a new exercise program is talk to your PCP first. Make sure that they give you the green light. We want to start slow. In geriatrics, we have a saying of go low and start slow. So, start where you feel comfortable, gain that ability of confidence, and then we can continuously move up. And that is really the best place to start, not going at the highest level possible and then getting injured. No, we want to start low, go slow, build confidence, and then progressively challenge the muscle. And that's really, really important. So some of the other areas when we talk about behavior change, right? Because this is a behavior that we have to add to our regimen, right? There are things that we know from research from our research studies that really show what are some of the key to success. What are some of the keys to actually not only starting resistance training or starting a strength training program, but also maintaining that, keeping that, continuously coming back, right? That is the key to the success and behavior change. One of those is around consistency. So when we exercise regularly, 2 to 3 times per week doing resistance training, that consistency allows us to really elicit the response that we need to be able to show improvements in our muscle health. Consistency also gets it into our schedule, into our routine. When we build something into our routine, guess what? We show up. If we have something on our calendar, guess what? Usually we show up for it. So by putting this on our calendar, this allows us to have that consistency, allows us to show up. Showing up is, again, that whole saying, 90% is just showing up. And truly that is, right? We show up, we're able to participate. One of the other components that I want to talk about is around intensity. So in order to actually break the muscle down to build it up stronger, we have to have adequate intensity and challenge to the muscle. So we have to be able to continuously, progressively challenge our muscle to be able to get stronger. So one of the other components is being able to have this adequate level to do that, and having individuals who are specialized who understand this and how to actually recommend this challenge is really important. Because again, we can get in our ruts, we can get in our routine, we can easily plateau, but being able to continuously challenge that muscle is really what's going to allow us to continue to get stronger, and continue to move that blue curve up and over, and maintaining that strength and muscle health. Variation, we really need to vary the exercise type, intensity, and repetitions. So we talk about this in our area of exercise science. It is really around that progressive exercise movements, really thinking about how we can change things up, because otherwise our body gets stale, it gets consistent, our body gets used to it. So again, we're not challenging it. So by varying things up, it really does allow our body to continue to kind of guess what's coming next. Not only does that make it fun, but it also allows for our bodies not to just get into that plateau. And then finally, really thinking about the role of protein, making sure that we're getting in adequate protein so that when we are challenging that muscle, breaking that muscle down, we have those branched chain amino acids, we have those essential amino acids to be there to help build that muscle up stronger. So again, all 4 of these are really key components to success. So I'm really excited to be a part of the Vivo program. I am one of the scientific advisors for this program. It has truly been a really exciting opportunity to be able to work with Vivo. And one of the reasons why I think Vivo has been really successful is because it's been built on science. We really worked very hard to make sure that we hit all of the scientific principles to be able to maximize our abilities, not only to improve strength and functionality, but also fun, and being able to make sure it's extremely safe for anybody who is participating. Because again, at the end of the day, safety is number one. It's the most important thing. We want to be safe and be able to have a good time. So for the Vivo programming component, there are 6 really kind of key components to Vivo. One of them is the small group classes. So one of the big things that we really wanted to focus on is making sure that we had not only a very educated instructor to be able to provide instructions to our members, but also being able to have an environment where we felt like we are connecting with one another, right? Accountability is key to success. And so those small groups allow not only for the ability to individualize the workout, and I'll talk about how the workouts are individualized, be able to provide that feedback, but also really be able to have that group experience and that accountability, and to actually be able to develop some friendships and relationships with individuals in the class. Second component is that periodized programming. So like I was talking about, being able to change up the intensity, being able to change up the repetitions, being able to change up the duration that we're doing it. So creating that challenge to elicit results, really making sure that the program is changing. So the program is different every single week. There's 52 weeks of programming to allow and make sure that we are actually able to challenge that muscle. One of the other components that I really love about Vivo is the dual task exercise. So when I say dual task, what I'm talking about is the simultaneous movement of the body, but also using our cognition. So it's brain and body moving at the same time as that communication. So what would that look like? Well, that could potentially look like me doing chair stands. So me standing up and sitting up from my chair and counting backwards by sevens from 100. So that's an example of a dual task exercise. It's doing a physical movement while also doing a cognitive component. The research behind dual task exercise, which has really been blooming in the field of Parkinson's disease, has shown this neuroconnectivity. So we're starting to see more neurological communication, brain muscle communication that has been shown to be a result of these dual task exercises. The holistic approach, so we really do incorporate elements of stretching, balance, and mindfulness in every single exercise, every single program and class, starting out with making sure that we are stretched, that we're ready to go, and ending with stretching and balancing so that we can really ensure that we are a comprehensive program. Functional training, so doing and emulating movements of our daily activities. So like I said, how often do we bend down to pick something up and potentially lift it up and put it on the counter? So this is an activity that we would be doing. It's a cross-body movement pattern with a rotation. So doing exercises very similar to that not only allow us to do what we call functional training, but also get us into a place where we're doing these movement patterns in a way that we're building up these muscles to help support the things that we are naturally doing on a daily basis. And the final component is around monitoring progress. So one of the key components of Vivo, and one of the things that I was really pushing on early on, is making sure that we are tracking progress and success. And so we do that by doing a baseline assessment. So we assess every individual that comes into the Vivo program, and we repeat that assessment every 8 to 12 weeks to see what progress has been made, what areas where you may not be improving, and what can we be doing about that? Do we need to challenge that a little bit more? Do we need to be thinking about that? We also spend that time to make sure that the environment is safe, especially on that one-on-one baseline assessment, and being able to provide the opportunity to set some goals. What is it that you want to achieve, and being able to work towards getting to those goals? So really kind of a very comprehensive program. So we have a couple of research studies that I have worked on with Vivo, and also from the assessment components. Vivo has shown, these are the overall results just after 2 months or 16 sessions of doing strength training. It's around a 22% increase in upper body strength, 27% in lower body strength, 25% increase in endurance, and about a 12% increase in agility. So overall, we're looking at around, upwards to 15 to 25% improvement of overall strength and functionality. So extremely exciting results, and very much mimicking the results that we see in our scientific body today. So again, very exciting. So what I want to do is just walk through what a Vivo program actually looks like. I think it's very helpful to be able to actually see it. So what the Vivo instructor does is they will send out the workout 24 hours before, so that if you want to, you have the opportunity to print out the workout. You also have an opportunity to actually watch a demo video. What we found when we did some of our early research is that individuals want to know what they're doing and would like to be able to see what they're actually doing. And so this is a way that we can do that. So every workout starts with a warm-up, a dynamic warm-up with hip, glute, and core activation. So really being able to get that kinetic chain moving. We move into a dual task exercise. So this is just an example of shadow boxing where a trainer may call out a sequence of 1, 2, 3, where 1 would be a left jab, 2 would be a right cross, and 3 would be a left hook. And then we start moving that around. Maybe that's a 4, 3, 2. It's a lot of fun. It's funny, it's kind of one of those moments to laugh at yourself and say, "Oh my gosh, this is come on, brain." But it's really, again, these are the components that actually are starting to create that neural connectivity. Again, we have a video demonstration of that. Then we move into our single leg balance. So we do a balance component in each program, each workout, because again, this is extremely important. But what I want to highlight here is that we have a level system at Vivo. Level 1 is going to be our chair or seated component. Level 2 is going to be something that may require a chair or a lower a component that's going to be a little bit easier. Level 3, we're going to move into a little bit more complexity, and then level 3 more complexity, and level 4 is going to be a higher complexity movement. So as you can see here, level 1 is a chair assisted single leg balance. So that could be and include, oh, you're not going to be able to see me, sorry, because I'm in the, I have my thing off. But that would just include holding onto something and lifting up our leg for a balance versus a single leg hold versus moving our eyes side to side versus closing our eyes in level 4, which is very challenging. But again, the idea here is meeting you where you are at. All of us are different. Some of us may have a knee injury, and so we may have to do, and this is a great example, we may have to do so if I have a knee injury, I'm going to be doing a seated knee raise. But if I don't have any injury in my upper body, I may be doing a tandem alternated bicep curl. So again, we level the exercises, not the person, making sure that you know what feels comfortable to you. Each one of these has a link that shows the actual exercise to it as well, so that you can really see the exercise, giving you that opportunity and confidence to know, okay, I feel like I could actually try this level 2 today. And then if I can't do it, guess what? We're going to do another round. I can go back to that level 1. So just wanted to show you this. I think it's very helpful to walk through it just to be able to see. And then finally, we end with our cool down. And also we end up with a homework assignment. We always ask, we want to keep moving, right? Like that is our goal. Is it's not just 2 days a week of strength training, but how are we moving our body every day? And so again, just kind of bringing in some awareness and homework of how we can actually improve our activities of daily living, improve and meet those CDC recommendations. So that is where I'm going to end. Eric Levitan is the CEO of Vivo. If you have any questions for him, please feel free to reach out to him. Also can reach me as well. But I want to open it up for some questions. If you have any questions, and I believe today was registration open today. So if you are interested in doing Vivo, we would be excited to have you. So let me open this up to some of the questions. Oh, okay. So I see here. Yes, is the class on Zoom or does it have to be in person? No, it's all Zoom. It's all remote. Being able to do it in the comfort of your own home. That's our goal here. I can't sign up if I don't know what the times are. Oh, yes. And so for this round, oh, Jenny, you already answered. I'm so sorry.
Okay.
Just see your answer. Yes. Vivo offers over 150 classes a week. And so what fits your schedule is what we want. So you can work with our care team and they will help you identify the best schedule for you to be able to meet your needs. And yeah, very exciting to be able to do that too. I'm really happy that we're trying this out this round to see how this works. But I think this just allows for more flexibility. Do you want to take that, Jenny? How to sign up?
Sure. Yeah. You'd go to the Ollie at Duke registration, our usual registration page. If you're already a member, you'd go into the courses or the course catalog, however you usually sign up for classes. We have lots of guidance on how to sign up. And, oh, yeah, well, you would go to our site, add that to your cart that you want to join Vivo, and a membership will be added to your cart also if you're not currently a member.
It didn't work yesterday. I tried to sign up yesterday.
If it was in the morning, I noticed it wasn't available yesterday. They were going to open it today, so it's definitely open
Okay.
today.
Okay.
Thank you for trying and letting us know because I thought there's no reason since we don't. It's any almost any day of the week. We
Right.
had four options last in the past couple of years, and we thought, so many people, don't know about the flexibility of Vivo. You could have it at your, convenience, basically Monday, Wednesday, Tuesday, Thursday. And we certainly have Ollie members on the West Coast who thought, oh, 9 a.m. is 6 a.m. for me. That's too early. But wait, Vivo will work with you. So we tried to take that out. I'll grab the link to our site while anybody else wants to ask a question.
Yeah, I'll ask. My friend who told me about this said that you could have like a introductory assessment and stuff. Does that come after you sign up?
Yes, you register through Vivo and add your Ollie membership, and they will reach out to you. And our first week of courses is September 8th, and that is when they would like to do this assessment. They want to make sure they can send you resistance bands, they can send you weights, they want to have one-on-one session with you, and that would happen during that week. And then your Vivo courses start the following week, usually twice a week. And then that's for 8 weeks. And at the end, you have a follow-up assessment so that you can see how far you've come. Does that make sense? Great.
Sure. I have a question for Catherine.
Yeah.
Um, First of all, very impressive presentation. Shows so much work, knowledge, research, and I love your enthusiasm. Um, so, one question I have is, you mentioned a study that was based upon 52 weeks of exercises, and another that was based upon 16 weeks of exercises. Um, I imagine and hope that your program, after the end of 8 sessions, would give you the tools to continue on your own. Would that be correct?
Yeah. So again, right. Absolutely, right? So you would have potentially have the exercise workouts from the first 8 weeks that you could utilize and integrate into your routine. What we find from a behavior science standpoint is most people, and we you can see this by how many people are actually meeting the recommendations, right? Most people have a very hard time doing this on their own. So when individuals have that ability to actually do it on their own, that is absolutely, yes, 100%. You can take it and run with it. Um, uh, the other components, I think it just depends upon, like, again, I'm sorry, I'm pulling in my science because we've looked so much at the ability to maintain behavior change. And so a lot of it has to do with putting it in your schedule, right? That accountability, that having it scheduled, having accountability. So having that check-in with other people is another key component to success. Not everybody needs that though. Again, that's only one of the key components. And then really trying to make sure that the environment around you is kind of built for that. And what I mean by that is being able to see your progress over time. That's another way of being able to continue on with these behavior changes. So self-motivation is one of the key components when we think about motivation and behavior change. It's just one of the areas that I think is harder for some people. And so again, individuals who are able to do it on their own, we are 100% behind you on doing that. And that's fantastic. And then individuals who actually do like the group support and that accountability can continue on to the Vivo program and continue doing the Vivo programming. So sorry for that long-winded answer. I've been really integrated and invested in looking at what are some of the facilitators and barriers to behavior change. And it's so fascinating. It's so individualized. Each person is very different in what really resonates with them. But at the end of the day, it's how can you meet those recommendations, those CDC recommendations, and what works best for you. So that is obviously always what we want, and I want as a gerontologist as well for my folks.
Sure. Of course, we all know our own records, and if we're if we're, well, I'll be honest. I started exercising when I was in eighth grade and wanted to look good, and
Yeah.
that lasted for about 8 weeks, and then I don't know what happened, and various times, we've all read what we're supposed to do, and we all
Yes.
saw from your studies about how many do it. And so I think motivation is a big one, and the setting is a big issue. I like your setting because I take it we won't be looking at each other's exercises on a screen. We'll only be looking at our own, and the
Yes.
trainer will only be looking at us other than ourselves. And so that has some appeal. I see that there's been some thought put into um, why don't people do this? We have all heard it all our lives, eat your vegetables and
Yeah.
exercise.
And
And
move.
it's only become, a louder uh, chorus of people saying do this and do that, but it's very hard to do. I'm attracted to this program because you've given some thought to how to keep people going. What is the cost of continuing to be part of the program? I presume that Duke got some sort of discount because how nice it is to have an established institution with a reputation and doctors and being connected to an integrative health systems. My goodness, you can't ask for a better recommendation than that. But I wonder what happens after 8 weeks and what
Thank
does it
you.
cost?
Yeah, thank you, Rick. I'm so glad you appreciate Katie's enthusiasm, and it helps me so much to hear every year out loud a person saying these things. And I'm definitely going to be, focusing on my protein. Um, again, I'll, just those reminders. Whatever works, everybody is a little different, and that's what helps me. The founder and CEO of Vivo is Eric Levitan. He's a Duke alum and
Yeah.
got in touch with us, and we do offer a small discount. It's not a big difference if you independently go with Vivo. We think Ollie has, a wonderful community and lots of great um, opportunities for membership and bonuses and perks. So we hope you'll consider going through Vivo, but um, are there discounts available? You mean Vivo independently? I don't know. Do you know
I
if they
just
do?
wonder what happens after 8 weeks. I know the Duke
Right.
program ends, and
We,
I'm thinking I would probably like to continue because of my inability to stick with things previously. I mean, it's
for
all I
sure.
can do to walk a couple miles a day. So, um, so I'm wondering, compared with being part of what's that, Duke Rex, health and fitness or whatever, it costs $100 a month or so. I'm just wondering what does the Vivo continuation cost, if
This
anybody
is,
knows.
what we love about this intro is it is 8 weeks. You try it out, you see what's wonderful about it, and you can take it on yourself and join Vivo independently of Ollie, or take it on yourself, do your own program, and maybe pick it up again in the spring. You have options. It's very flexible.
Okay.
Yeah, and we do offer there is a discount for after you do Ollie, after you do it with Ollie, there is a discount. I just can't remember it. I'm so
Um,
sorry. That's on me. But
Oh, that's
we offer Ollie members a discount if they want to stay on and continue with us. I want to say, I just don't want to write. I think it's around $85 dollars a month when you continue on, but I don't quote me on that, even though we're being recorded.
no, sure.
um,
And Vivo's
um,
new
but
too,
yeah,
right? I mean, it's how many years has Vivo
five
been doing?
5 years,
I
5 years
see.
old. It is new. In the term, we're still considered a startup. We're on the fifth year here. Um, And what I would also like to say is one of the other key components, and I know we're up on the time, is that we always want feedback, and so I think that's one of the other beautiful parts of our Ollie program is we always want you guys to provide us with feedback if you have some, so that we can keep improving this program. Our program has improved because of our Duke Ollie members, and I'm really just we're so appreciative of our Duke Ollie members who work with us and do this. So yeah, we're really excited to have this partnership. But Rick, I can find out exactly what the amount is, what the discount rate
if it's
is.
on their website, fine, I can do it. I haven't looked at their website, but
It is not. It's not going to be on our website. So let me do that, and I will get back with Jenny,
okay.
and she can reach out to you if that's okay.
Wow, that's terrific. That's terrific.
Yeah.
Thank you so much.
Yeah, no problem. No
And
problem.
on the topic of it's a small world, isn't it? Um, my daughter worked for Techstars for a year in Minneapolis. Are you familiar with Techstars?
We did Techstars. We were
Right.
a part of Techstars longevity startup. We did that back in, I think, right after COVID. It was like 2022. We did it. So yes, very familiar with it. I did it with Eric, and got to go up to DC. It was a lot of fun, and really has helped accelerate our startup as well.
For
So that's
sure.
awesome that your daughter works for
It's pretty
Techstars.
classy. The presentation is really classy.
Thank you.
You're I don't know what you call it, but just the presentation, the words, the organization of the slides. You made your points.
They're a very sharp
Thank
team.
you.
We're so pleased to be partners. I'm going to stop recording now.
Oh, okay.
Yeah.
Sorry if I
That's
was
okay.
Thank you.
too talkative.